Let's go play house. Let's go play house.
My name is Rohit Mishra. I work as a managing director with Starkey Technologies. We are the manufacturers of the hearing aids. We are driven by the vision of Mr. William F. Austin in America, who believed that every child is unique, who believed that every child must get an opportunity for the self-respect, for the dignity and the contribution he has to make to the society. He believes together we can make a brilliant change in the society. Together we can do much better than an individual can do. Keeping that in mind, I realized that the disability that we're dealing, the hearing impairment, has got a lot to be done and addressed. So when I was in US and I went to Australia, I went to some of the education institutions, some of the early intervention centers who were providing these therapies, who were providing the solution and rehabilitation and the early rehabilitation for the children who were suffering with these impairments. Coming back to India, I realized I did not find even one which matches the standard of any of the centers I had been to in Australia or in US or in UK. And that gave me a reason to come back with a conviction to open something better, because every child deserves equitable opportunities, and we were not getting those opportunities. So idea was to bring the same facilities, the same intervention, the same kind of services, or probably better, because Indian child does not deserve any less. Keeping that in mind, we came up with the idea of listening ears. Listening Ears is one intervention center where we handle and we provide assistance to the children with hearing impairment, children with learning disability, children with autism spectrum disorders. It can be multiple disabilities, but we have got a team of audiologists, ABT experts, ABA expert, occupational therapists, most importantly psychologists and a normal teacher who will not only tell parents how to look at the situation objectively and practically, but also counsel them that it is not a good idea to ignore, it's not a good idea to wait. The best idea is to run fast so that we can help the child catch the bus that he had missed or he might miss. Have a certain disability might come with a comorbid situation, which means he might have a need for additional assistance through some other specialist. It might be a special educator, it might be an audiologist, it might be an ABA specialist, it might be an occupational therapist, a psychologist. There are multiple things that each of them can add in terms of dimension of the development of this child while he is looking forward to integrate himself to the mainline, to the mainstream.
Occupational therapy profession, it revolves around the term occupation itself. For children, the occupation for them is primarily to be able to play, to be able to go to school and meet the classroom demands. So any deficit caused at the time of birth or even during their developmental early years or even due to any neglect in the family can lead to certain delay in the age appropriateness of their developmental skills. They may not perform what is expected at their age level. So we as occupational therapists, we identify and we address the level of the child, why a child is particularly not performing in a particular way, and we intervene their developmental skills. We want them to be functionally independent in their daily life.
Speech-language pathologists play a key role in maximizing the communicative abilities of children with special needs. The first 3 years of life are considered as critical years, as during these years the maximum amount of development for the higher functioning happens. The various kind of disorders that speech-language pathologists assess, diagnose and intervene are children who cannot speak clearly or cannot speak a specific sound, children who have a problem in maintaining the flow of speech or fluency like stuttering, children who are not able or have some kind of voice disorders like harsh voice or inappropriate pitch of speech, also children who have any kind of oromotor problems like problem in swallowing, chewing or any kind of sensory issues. Also, the speech language pathologist deals in development of language, that is the reception, that is the understanding of language and the expression of language. The various kind of language disorders that a speech language pathologist deals with is autism, attention deficit disorder, or any kind of syndromes.
Special educator work as a teacher for special children. So they work with other professionals and the family members to write an individualized education program IEP for who are struggling academically, socially and personally. So assessment, instructional plannings and the therapies are the duties of this particular position. Special educator work with the children who has behavioral issues, learning disability, hearing impairment, autism, etc. We use the holistic techniques to use such students. We work on short-term and long-term goals according to the current functioning level of the child, and we share these goals with the parent too, and we monitor, we evaluate and accurate the progress of the child.
Psychologists basically work with the parent as well as with the kid. So basically what you require to do with the kid are the various sort of therapies that you can provide, starting from the ABA, that is the Applied Behavior Analysis, in which you basically promote what is the good behavior in the kid, and you basically decrease what is the harmful behavior for the kid through various techniques that you apply, the operant conditioning and various things.
The detection and intervention of the hearing loss before 6 months of age leads to better improvement in the child than intervention after 6 months of age. So, newborn hearing screening has become universal in all the hospitals. So, children with hearing problem being identified at much earlier stages. At listening ears, we have a variety of equipment and a sound treated room as per the guidelines given by Rehabilitation Council of India.
Very good.
Reported by WHO, most of the population by 2020 in a geriatric population and in the childhood going to have hearing loss. To stop that, to prevent that, we have a tool called autoacoustic emissions, or we can say early detection. Early detection can be done using OE or ABR, automatic ABR. Basically, autoacoustic emissions tool, what we do in that OE, we try to take the responses from the outer hair cells, which is located in the inner ear of the human. If we are getting the responses from the outer hair cells, it means hearing is perfect. In listening ear, we basically focus on the early intervention, early screening, early diagnosis. So, though for the same, we have a collaboration with different hospitals over here, and we started the universal neonatal hearing screening. It's just an effort, it's just a step we are taking, because in Delhi, in North region, we don't have universal implication till date. So we are trying to do that, and it's a small step. And what we did basically in Saigal, in the XYZ hospital, a different hospital in which we collaborated, we have included our hearing screening in the basic test like vaccination and all. So it's become a package. So every child have to go through the autoacoustic emission, so we can diagnose as early as possible. So from that we got a lots of child which we already give a help and intervention.
At Listening Ears, we empower parents because parents play a very important part in the development of the child. Because the child stays with the parent for the rest of the day. They come here for therapy for 45 minutes, 1 hour, 2 hours, or 3 hours. But for the rest of the hours, the parents need to know how to deal with the child, whether it's an autistic kid or it's a kid with hearing impairment. It is very essential for parents to know the needs of the child and know the functional level of the child. So in our session, what we do is we guide parents and counsel them to work with the child at home. We give carryovers to the parent as well.
The empowerment happens when we involve our parents intensely during our therapy sessions. And so the parents are given the freedom to observe the sessions, ask questions, discuss about their child's improvement, and also give their valuable feedback to us.
Up to 8 children per 1,000 live births have been estimated to have hearing loss. These early years of life, that is 0 to 6 years, are the most important and critical in terms of cognitive, social, emotional, physical development of any child out there. So a child who struggles to hear may also struggle to learn to speak. They underachieve at school and also end up being socially isolated. So at Listening Ears, we do early intervention. Early intervention involves identifying and working with these children who are deviating from normal development. And this is the mainstay of Listening Ears.
Tahur was diagnosed with a hearing loss at the age of 2.9. So she was fitted with a hearing aid, and then they came here to enroll her in Listening Ears. So we enrolled her in intensive therapy program. So initially when Tahur came here, she was only vocalizing. She did not have any true words or real words. She was not able to produce any sounds. And intensive therapy program is a program where we work like intense attention is given to each child. Sunday and Monday, Thursday and Friday, and then the Saturday, days of the week. Right, 12.
Twinkle, twinkle, little star, how I wonder what you are. Who's coming? Meow. Tickle, 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 tickle.
My son, thankfully, by God's grace and guidance from right people at the right time, is now being mainstreamed to a reputed school of Noida. But it was not like this from the very beginning. He got diagnosed at the age of around 18 to 19 months with bilateral sensory neural hearing loss. And once the things are diagnosed, you have to start with a very, very rigorous therapy. The second important thing is acceptance. You have to accept it. It is difficult. It is very difficult to accept, but please don't waste time. We did that. We did not compromise on the therapy part. We got delayed in diagnosis, but we did not compromise on the therapy part. Thankfully, I came to the right place at the right time at the center, and we worked as a team. And we went for auditory verbal therapy, which is commonly known as AVT. And it is basically a parent professional partnership program. It's not only about what the therapists are going to do, it's about what they are going to teach you how to do with your kids. And we came to Listening Ears. Here I found a very, very supportive and cooperative team. And the best part of the team was that they were very receptive. They understood my child. They understood his psyche. And they guided me in such a supportive way. It's not only about the professional guidance they gave it to me. It was about the personal support also. At that time, I was devastated. My family was devastated. No one was there to support, but it was only Listening Ears who really supported me, who boosted up my confidence, my morale, who believed in me and my son. And because of this all only, today I can proudly say that my son is going to a mainstream school.
Golden baby bear, then mommy bear, daddy bear, then Paul.
So don't be disappointed if the child is wearing a prosthesis, if he is listening through the prosthesis and not through his natural ears. He is listening, he is speaking. So just understand it, just make it your way of life and just go ahead, because life is beautiful and the sky is not the limit for children.
Hi, my son's name is Dabir. He's 4 years old. He's a bilateral cochlear implant recipient. When he was around 6 months old, we came to know that he has profound hearing loss in both ears. It was shocking for us because there's no one in our family who has hearing loss. The whole family was saddened. It took us a while to believe it that he cannot hear us. Then later on, we were thinking what to do. Then we found out about cochlear implants. Then the surgery followed when he was around 1.5 years old. After surgery, the most important and the challenging part of giving him the speech therapy started. We went around various centers, but around for a year there was no significant progress in his speech. His audition was a bit improved. He could hear us. He was responding to some environmental sounds. He was responding to his name, which was a big milestone for us. But every day there was a kind of feeling which I had that something is not right, something is missing. And so I started searching for a better place. Then we found out about listening ears. It was very important for us to give him the best speech therapy because we belong to a place where he's the first and the only child implanted with cochlear. The first day when I came to listening ears, I was impressed by the program they had. They have a very comprehensive multidisciplinary program, and they provide 5 days regular program to the kids who has hearing loss, and it's the only center in the whole country which has this kind of facility. And it is a parent-child both related program because here, along with the child, the parent is also taught how to talk to your child, how to continue the therapy which is being provided in the class at home. Then one more thing which fascinated me was they have 4 different teachers for in each area of the therapy. They have overall program. They have one specialized therapist for speech, one for language, one for audition, one for cognition. And that's where I decided that this is the best place for my child for his speech therapy. Then after we joined listening ears, after a month, I noticed a drastic change in him. My boy, who was speaking no words before joining here, he started naming fruits, vegetables, animals. It was kind of surprising for us. From then onwards, every day was amazing for us. His progress went up so high that we couldn't believe our ears, that we started to feel like we are talking to a normal kid. Sometimes we tend to forget that he has hearing loss. Then the months passed by. After around 6 months of joining listening ears, he started, his word level came to 2 words. Then he started talking in 3 words. Now, Alhamdulillah, it's almost been 10 months now. He's talking to us in a sentence level. His language is comprehensive now. I can talk, he can communicate his daily needs very well. Like basic, he can ask me if he wants anything from the fridge, if he is hungry, if he wants to sleep. It's so easy for him to communicate now. And I feel it all happened because of listening ears and the therapists who are here for the extraordinary work. Since the day one I've joined here, I felt like a family here. I'm grateful for them, for their cooperation. They're always ready to answer my endless questions. Their support is really enormous. Bed and? Where are we going?
I'm Arivi's mother. He is 8 years, 9 month old, and he has moderate to severe loss, and he is doing very good. Now we were here with Listening Ears team September 2017 to May 2019, and in that period he did very good. We got very good response, and after that now he is going to mainstream school.
My name is Ivy Sharma. I am 8 years old. My father's name is Aman Sharma. My brother's name is Surya Sharma. I have one sister. Her name is Nandini Sharma.
क्या बताऊँ मैं, सब ठीक ही चल रहा था। स्टार्टिंग में तो मैं और मेरी वाइफ वर्किंग थे, तो मालूम ही नहीं चला मतलब कब ये सब हो गया। तो धीरे धीरे फिर स्कूल में ज्वाइन कराया उनको, वहाँ से शिकायत आने लगी कि आपका बच्चा सुनता नहीं है, बात नहीं मानता, अलमारी में से चीज़ें फेंक देता है और इधर उधर घूमता रहता है। फिर हम बुलंदशहर से नोएडा आए, वहाँ पे दिखाया, एक इंस्टीट्यूट है वहाँ पे दिखाया हमने, तो वहाँ पे मालूम चला कि ये ऑटिज़म है बच्चे को, स्पेक्ट्रम हो गया। तो मैं और शीतल ऐसे हो गए, बिल्कुल कुछ मालूम ही नहीं क्या हो गया। बहुत देर तक रोते रहे, पूरी रात ऐसे ही निकल गई, दिन ऐसे ही निकल गया और मालूम ही नहीं चला मतलब क्या करना है क्या नहीं करना है। नेट पे देखा और जितनी भी जान पहचान थी सबसे पूछा, तो फिर यहाँ पे रेफ़र किया लिसनिंग ईयर्स में। तो अभी मुझे हो जाएंगी 45 क्लास हो गई हैं यहाँ पे, तो यहाँ पे काफ़ी अच्छा रिज़ल्ट है, मतलब ठीक लगता है। अब मतलब नींद भी आने लगी है प्रॉपर जैसे रात में, तो अब सेटिस्फेक्शन है कि हाँ। लेकिन ये है कि बस जो मुझसे गलती हुई, मैंने जब भी ठान लिया था कि मुझसे गलती हुई है तो मैं मतलब अपने बच्चे को ठीक करूँगा। टीवी मोबाइल सब मैंने रख दिया था एक, अब जाके मैंने टीवी लगाया है। मैंने मैम से करा था डिस्कस के इसे दिखाऊं, तो मैंने अब जाके टीवी लगाया। 30 मिनट्स में दिखाता हूँ उसे कार्टून। हाँ करो, और नोज पिंच, पापा की नोज पिंच। हाँ
मैम तनिष्का बेटी है मेरी, फर्स्ट टाइम वो 8 मंथ की थी तब मुझे पता चला कि वो सुन नहीं सकती है। कंफर्म नहीं था, मैंने टेस्ट वगैरह कराए, 3-4 महीने हो गए मुझे उसको दिखाते हुए, तो उस पर कंफर्म हो गया कि वो नहीं सुन सकते। मैं उस टाइम में इतना दुख हुआ था, मैं रोने भी लग गई थी। मैम सबने मेरा साथ छोड़ दिया था उस टाइम पे, किसी ने मेरा साथ नहीं दिया था। मैंने हिम्मत करी, उस टाइम बाद टेस्ट कराने के बाद मैं लिसनिंग ईयर्स में आई। मुझे यहाँ पे गीतिका मैम मिली, उन्होंने मेरी बहुत हेल्प करी क्योंकि तनिष्का की थेरेपिस्ट है। उन्होंने मुझे इतनी हिम्मत दी मैम, आज मैं इतनी ट्रेन हो गई हूँ कि मैं अकेली उसको लेके आती हूँ। हाँ मेरी बेटी इतनी हो गई है, मतलब इतना चेंज आया है उसमें, काफ़ी चेंज आया, अच्छे से बोल मतलब कोशिश कर रही है बोलने में। मुझे उम्मीद आ गई वो बहुत अच्छे से बोलेगी, नॉर्मल बच्चे की तरह हो जाएगी। स्टार्टिंग में मैम उसका इम्प्लांट हुआ था, थोड़ा मशीन निकाल के फेंक देती थी, तो जैसे तैसे मैंने उसको आदत डाली तो हो गया। अब इतनी आदत डल गई है उसको कि वो मशीन बिना रह नहीं सकती है। बैटरी लो होगी तो बोलेगी मम्मा नहीं, आवाज़ नहीं आई। अब इतना अच्छा लगता है, मुझे थोड़ी खुशी होती है, आगे भी उम्मीद है वो बहुत अच्छा करेगी मैम।
पिंक कलर स्टार, ओके। कलर 2 you want 2 stars, ओके।
और ये क्या है? बेड पे क्या करते हैं?
बेड पे सोते हैं।
Very good. I'm here to talk about my journey. My son Rohan, he's 10 years old and he's diagnosed with autism. When I came to know I was pregnant, the joy, happiness, everything was, great. And the plan was that after my son grows up, 2-3 years old, he goes into school and I go back to my teaching career, right? That's the plan, normal things. But by then the diagnosis happened and I could see the end cupboard on my life. Everything came to a standstill. Career ended, slowly friends slip away, social life slips away. And it's basic human nature to go into a little bit of a depression. It's basic human nature to think, why me? Why this has happened? What did I do? Oh no, my life has ended. What's going to happen now? But that this journey changes us in many, many ways. It makes us more compassionate, strong, no doubt. It makes us hugely and fiercely strong. And it makes us kind, it makes us understand human emotions. For him, I have to be his advocate. And what is the first thing that we need to do is, here I would like to stress upon is the role of early intervention, right? So though my son is 10 years old now, just see his graph going swoop, I mean, I'm not an expert, but when we did meet with the experts, when we did, do the counseling, when we did put him in therapy, I could just see so many positive changes. I would just urge parents that please don't be an ostrich. Don't put your head inside the sand and think, it is ठीक हो जाएगा, over time ठीक हो जाएगा, and push him to go to regular school, do those things, because this is something that this is a marathon, it's not a sprint. You need to brace yourself, you need to pace yourself, you need to run you need to run forever. Okay, there is no finishing line for this, and you are there, and your son is there, your child is there with you, and so please brace yourself for the long haul, and do the early intervention is my message for you.
Today is Harsh's cochlear implant switch on day. So today his implant will be activated for the first time, and he's going to hear for the first time through the cochlear implant. He was fitted with hearing aids when he was 1 year 3 months old, and they have been taking auditory verbal therapy since then. Today he's 2 years 6 months old, and today is his activation day. Try. Okay, good try. Very nice. Shh. Try. Good. Come on, high five. Acha, high 10. High 10. Yay! Very good. And good. Harsh, good. Wow, very good. Good.
मैम जब ये 9th मंथ का हुआ था ना, तो उसके बाद एक्चुअली इसका 9th मंथ में हार्ट का सर्जरी हुआ था। तो जब सर्जरी हुआ था तो थोड़ा ज़्यादा केयर करते थे हम, इसकी आवाज़ भी लगाते थे ज़्यादा, क्योंकि उससे पहले हमको लग रहा था कि तो सब कुछ नॉर्मल है, तो नॉर्मल बच्चे की तरह ही, क्योंकि इसके सारे पहले भी टेस्ट हो चुके थे, तो इतना ध्यान नहीं दिया। फिर इसका जब हार्ट का सर्जरी हुआ, अपने पास बिठाना, मतलब मोस्टली 1-1.5 महीने तो अच्छे से हुआ था, तो आवाज़ लगाते थे तो ये रिस्पॉन्स नहीं करता था। तो कुछ टाइम तो हमको ऐसा ही लगा कि ये थोड़ा वीक है इसलिए नहीं करता है। पेरेंट्स ने भी मतलब दादा दादी ने भी बोला इसको कि थोड़ा वीक है इसलिए नहीं शायद करता है। तो हमको 1-2 महीना हो गया, तो फिर हमने सोचा कि ये इतना वीक भी नहीं है, मतलब कानों में आवाज़ तो जानी चाहिए ना। तो फिर हम इसको हॉस्पिटल लेके गए, तो वहाँ उन्होंने OAE का इसका टेस्ट, हमने वो पुराना वाला रिपोर्ट दिखाया इसका, तो वो उसने कहा कि सर ये नॉर्मल है, तो फिर इसको रिस्पॉन्स क्यों नहीं कर रहा है। तो वहाँ मैम ने बोला कि इसका OAE का टेस्ट करा लेते हैं, उसमें क्लियर हो जाएगा। तो वहाँ इसने रिस्पॉन्स नहीं किया बिल्कुल भी। वहाँ डॉक्टर ने बोला कि ये साइलेंट दिखा रहा है। तब नहीं समझ में आया कि क्यों साइलेंट दिखा रहा है। फिर उन्होंने बैरा के लिए फिर से बोला कि बैरा कराना है इसका। फिर तो बैरा चले जा नहीं सकते। फिर रिपोर्ट्स हाथ में आई, बहुत टाइम समझने में लगा कि ये क्यों हुआ। हार्ट का भी इसका हो गया, उसके बाद भी फिर धीरे धीरे चलता रहा प्रोसेस। तो इसको डेट मिला था नवंबर का हार्ट का ऑपरेशन का। फिर हार्ट का ऑपरेशन हो गया, उसके बाद हमें इसके कानों का पता चला। फिर कानों में भी बहुत टाइम लग गया समझने में, सोचने क्या करें। थोड़ा कॉस्ट भी ज़्यादा थी, वो भी नहीं करा सकते थे। तो फिर हमने यहाँ लिसनिंग एड में सुना कि यहाँ चल रहा है साहब कि बाहर से मशीन आती है, बच्चों की हेल्प करती हैं, पेरेंट्स की हेल्प करती हैं। फिर हम यहाँ मैम से मिले, तो उन्होंने बोला कि थेरेपी के लिए। फिर हमने लगभग 1 साल 3 महीने का था तब इसको ये मशीन लगी थी। फिर धीरे धीरे करके टाइम हो गया, 1.5 साल तक ईयरिंग चला इसका। उसके बाद उसको बहुत अच्छा रिस्पांस भी आया, अपना नाम पहचानने लगा, बाकी की आवाज़ें जो हैं वो पकड़ने लगा, सुनने लगा। अपने नाम से तो बहुत अच्छे से 1-2 महीने में ही अपना नाम अच्छे से पहचानने लगा था ये। अब तो इसका ये हाल है कि कहीं भी कोई भी आवाज़ आती है तो जल्दी से जाता है, और मतलब कुकर की सीटी की आवाज़ आई तो जाएगा, तुरंत बंद कराएगा। बेल बजेगी, डोरबेल बजेगी तो बोलेगा, मतलब जाएगा देखने भी। फ़ोन हम इसे छिपा के रखते हैं, अगर किसी का कॉल भी आया तो पूछेगा कहाँ से आ रही है आवाज़। तो अभी बहुत फ़ायदा हुआ है इससे, और अभी इसका इम्प्लांट हो गया है, तो अब देखते हैं।
Hello, I'm Shafia. I like Doraemon. I want to become police.
When she first came to listening ears, she had no language or communication skills. She was diagnosed with hearing impairment at the age of 2 years, and she was fitted with hearing aids, and following which she was enrolled for intensive therapy. After 1.5 months of dedicated therapy, she uttered her first word, no. This was just the first step of her rapid learning. The credit goes to the mother as well, as she was very hardworking. After 2 years of intensive training, now the child has age-adequate speech-language skills, and she has been successfully mainstreamed into a normal school.
Most people believe that listening aids is going to be the most expensive proposition, and it will be difficult for a child to get intervention there. I want to say that we have found so many people with golden hearts who have helped us to not only discount the price, subsidize the price, but to make sure that we have possibly now become one of the most economical intervention providers in the country. When I say economical, it's not about being economical in terms of being cheap. We are the best in terms of curriculum, we are the best in terms of outcome, and our outcome speaks volumes about the input that our so blessed, brilliant interventionists provide to the child. That we work in Starkey, we have got Bill Austin who supports the idea, and we have this opportunity to make this difference to the life of these children. And one has to be so blessed to have a team the team that I have in listening ears. They are so brilliant, they are so patient. I've seen parents losing their patience, but I've seen these people, my team, the interventionist, they work like an additional parent. They never lose their cool, they never lose their patience. They are so persistent, constant in terms of their attention to the child to bring out the best. I find them committed not only towards the children but also towards the parent, because they have to counsel the parent. And it's important to have a successful center running around the contribution from the team that you have. I think Listening Ears has got the best team in India for the interventionists that we have. The idea of Listening Ears, as of today we have 3 in Delhi and 3 more in Bangalore, Amritsar. Now the question is not to have just about these 6. The question is, India needs more than 200 such centers. It's unfortunate that we have got limitation. If I have my way and if there's a support, I would like to open 200, because it's not limited to a metropolitan city. It's not limited to a city which has got more people. It is required in A class, B class, C class, every city, because it is not a city-centric disability. This disability is a cross-population. We need to reach out to as many places as one can reach, and 200 is a number which will only suffice to handle 10% of the need that we have.